Hello, everyone. This is Christina Ioannidis from CPTC Aquitude. Welcome to today's webinar. I'm thrilled to have you with us for the Patient Experience in Vision 2030, Key Requirements for Healthcare Organizations. I am hopefully you'll be able to see the presentation that I have just shared with you, which is what we'll be discussing through today's session. So my name is Christina Ioannidis, and I have been working in the field of patient and employee experience for a very long time. And I'll give you a bit of an introduction on one of the wonderful opportunities of being involved in Saudi Arabia. So this is me. I've been working in the sphere of patient experience since 2007. Originally in the UK, then right through to worldwide and the GCC, having moved to the UAE in 2014. I've done great projects and have clients with Cleveland Clinic, Ministry of Health Bahrain, Royal Hospital Amman, Attend, which is a charity in the UK, also in the healthcare space. So we have been working in this sphere for a very long time, and we're delighted to have partnered with Creative Patterns Health Training Company, our Saudi partners, to bring our global perspective into Saudi Arabia's very big ambitions for growth. So what do? Aquitude Health, with CPTC, we're focusing on total experience for healthcare. What does that mean? We think about organizations when they're moving or working in the healthcare space. In order to survive, they need to have a razor-sharp focus on delivering value to customers in terms of both internal customers, their employees, and external customers, their patients or customers. So the end-to-end experience is a combination of patient experience and employee experience. As I mentioned earlier, we've been working in this sphere for a very long time, and our uniqueness, if you like, within the market is that we focus on what we call true end-to-end patient experience. We take the holistic approach, the end-to-end view of the patient experience. And you can see here, we have a diagram where we actually, it's the model of the phases that a patient would go through from being aware that they have a condition, considering where they may be, where they may have this condition dealt with, then the access and the actual service delivery, which is going either to a hospital or seeing a physician, and then the follow-up ongoing care. So we focus on the whole, if you like, all the 5 phases, the whole journey. Most healthcare organizations and most consultancies working in this sphere focus on service delivery, and this is the delivery from the moment a patient enters an organization or a healthcare or a clinic or a hospital, and then the moment they depart. We believe, and our experience has been, especially in the age which we'll talk about post-COVID, where we are in a new digital age, we need to be thinking and working in a sphere of, in the awareness phase, so the top right, we have prevention. We need to be talking about preventative medicine, education of patients, the choice factors, the factors that will make them decide to use your organization over another, the channels that they may use to or choose to communicate with you. Is it they're going to do an online research, or is it going to be that they're going to just get on the phone, Google, and then get on the phone direct to speak to your call center? Then it's the consideration phase, is the piece of what is different about your organization that will then drive that consideration for the patient to come to you. So this phase is all about understanding the mindset. What are their problems? What are they thinking? What are their fears? When a patient has got a condition, of whatever condition that might be, there's always a fear factor. And so we need to be aware of those. Then, of course, you have access. Access is, how do I have access to the services that you offer. And here we need to think about new technologies. We need to think about things like predictive medicine. When a patient may see, for example, a GP, what predictive medicine or artificial intelligence could indicate that a combination of symptoms is likely to indicate that this patient has A, B, C, or D. So here we're thinking about understanding technology adoption, which is notoriously difficult in the sphere of healthcare, only because it will disrupt the traditional workflows that take place in the traditional hospital or healthcare settings. Obviously, a lot of you who are part of this webinar today will understand a lot about service delivery. This is the moment a patient enters the organization or your healthcare institution and then departs, having had their triage, their labs that they needed, they see the physician, and if they're inpatient, of course, their inpatient experience followed with the what is when they get discharged. So then you go into the last phase, which is ongoing care. And here we've got an extraordinarily important part of managing disease and managing ailments, which is the ongoing long-term management of disease, where you have the introduction of things like digital health coming in. So you see, we work on this end-to-end mindset. So we take the preclinical, so awareness, consideration, and access points, as well as the post-clinical ongoing care to the traditional service delivery model. And we've worked in with a wide array of technology, and so we can support, and we do support healthcare providers in finding the most relevant systems and solutions to really drive that patient-centered, future-scoped care and processes. And we're going to talk about today Vision 2030. Everything we do in Saudi Arabia also has to abide by the Cbahi standards. Now, when we're talking about the kinds of things that we do, and this is part of our introduction, is we do a lot of capacity building, and we work with hospitals and the various clusters in Saudi Arabia in helping build learning and development of skills in multitude of areas. In the management area, we have operational excellence, where patient experience, strategy management, and measurement are key. We also have customer centricity and quality management, clinic management and profitability, strategic business planning for healthcare, as well as managing change in healthcare. That's the operational excellence. We also do a lot of work around communication and being empathetic, and being one of the key skills in healthcare today is that compassion and empathy. So right words at the right time, being an empathic nurse, complaint handling for healthcare, customer relationship management, ethics in interactions with healthcare professionals, and how to create instant rapport and connect in seconds. In the last area of management, we have cultural competency, which is all about diversity. It's really key in today's healthcare institutions, which are very national, they're multicultural, is to think about the importance and understanding of building bridges between the different cultures in the organization. We also work in the sphere of marketing, and this is where we're very unique. And part of what we do is focus on healthcare strategy, strategic marketing for healthcare, digital marketing for healthcare, social media management for hospitals and clinics, PR and reputation management for healthcare. All of these are going to be core when we talk about Vision 2030, which we'll do in the next couple of slides. And technology. I mentioned earlier, when we work in the 5 phases of what we call the end-to-end patient experience, technology is fundamental. And we work on the sphere of healthcare of the future. Healthcare is going to shift. COVID-19 has shifted the way patients want to interact with physicians. So we look at artificial intelligence, telemedicine and virtual care in the metaverse, practical blockchain applications in healthcare. We look at how to use disruptive technology and embed them within healthcare to provide and deliver excellence when it comes to patient experience. So, as I mentioned in the beginning, we're talking about patient experience in Vision 2030 and the key requirements for healthcare organizations. So what are we going to look at? We're going to look at Vision 2030 and its impact on patient experience. We're going to understand the connection between Vision 2030 and Cbahi accreditation. Cbahi, I will explain what it is, but they're fundamental for the country transformation. We also have strategies to balance patient experience and patient safety. And we need the duality, which is critical for accreditation. And finally, we end with the do's and don'ts in managing effective transformation. So here we go. This is where we're going to go to talk about definitions. And I always start with explaining or actually having a conversation around what is patient experience. Most people, when we talk about patient experience, say, well, it is how the patient goes from the beginning of the journey to the end. It's the steps that they take. Well, actually, we take a much more emotionally centered view, and it's how patients perceive their interactions with your organization. The emotions associated with each interaction will shape the patient experience over time. So when we're talking about patient experience, from awareness right through to ongoing care, that 5-step model I showed you, we have to think about how is the patient feeling at each of these parts of the puzzle, if you like, of the journey, and also how you're going to appease them and delight them. So this is where don't take the traditional view of it's a process. It's actually a set of emotions. And this is very important. And the reason why I always define it in the beginning is because will shape the types of interactions we actually embed when we undertake consultancy and capacity building within healthcare institutions around delivering that unique patient experience, or that delightful patient experience. So we've got the bottle of Heinz tomato ketchup that everybody knows and loves, unless you're 15 years old or under. This was a traditional Heinz, traditional bottle that Heinz actually launched with. Now, one of the challenges is, of course, those who remember using it, is actually getting, when you get to the bottom of the beautiful ketchup and you've got a little bit remaining, is the challenge of getting what's left out. And this is what we call the old-fashioned organization-centric experience. Why? Because it's a very functional bottle. It was very, very good at showcasing the product, but it wasn't good at actually getting the whole actual product out of the bottle, which is one of the reasons why when we talk about real patient-centered or customer-centered experience, we always invoke, and I always give the example of the new ketchup bottle, the new that most people who are now under the age of 15 or 20 will now recognize, and everybody now recognizes as the current ketchup bottle. Why? Because Heinz realized that this challenge of doing your shoulder out every time you needed to get the last bit of ketchup out was part of a negative experience. So they invested a lot of money in creating this squeezy bottle, which has become now equally as iconic. And the reason why they did this, the reason why they spent millions of dollars in actually this new product with new packaging, with obviously requiring new transportation modes and different ways of being showcased or merchandised in a supermarket, is because they realized that they needed to delight their customers. And this is much easier, much more efficient, and it's also effortless. And that's what we focus on when we talk about patient experience. Is your experience not only emotionally engaging, as I mentioned earlier, but is it effortless? Are we making it easier for the patient? And so that's how we, when we talk about patient experience, that's the mindset we take and follow the definitions. Now, recently, we've all experienced a major shock to our systems, both healthcare and organizationally and individually, and that's COVID-19. But one of the great things, if there's a positive that's come out of COVID-19, is that now people have changed. What were our traditional patients have now, their mindsets have actually changed. And this is from research in the US. The Harris poll in June 2021, the US, they did a big piece of research and they looked at how are people feeling about their interactions with healthcare providers. And they've outlined a new trend, which is called the pandemic migration. In the pandemic migration, many people use telehealth for the first time. And the majority of those, 65% of patients, plan to continue the use of telehealth in the future. So what we've seen is that there's a mindset shift from patients worldwide, although this is very obviously a US centered poll. And this is something that we focus on. Why? Because when we're talking about the healthcare sector transformation pillars, and remember, this presentation is all about the healthcare Vision 2030 and the healthcare sector transformation pillars. When we think about that, part of the transformation looks at the interactions between the hospital and the patient. But when it comes to patient experience, actually patient experience is at the top. So at the top of this circle here, we have improving quality and efficiency of health services. That is a strategic level of focus for Saudi 2030, for the healthcare sector transformation pillar. When we're looking at quality and efficiency, that's where patient experience comes in. And what's important to highlight, I'll move on to the next slide, is that the core of that ambition is also focusing on providing integrated and people-centered healthcare. When we're talking about people-centered, it goes back to the definition of the emotional the perceptions of each interactions and the emotions associated with those that your patients have. And that's where everything that we're talking about sits within Vision 2030. Value-based care means that hospitals are going to be judged and rewarded for their interventions and for the care that they give on the back of the feedback they get from their patients. And this is a step change for the kingdom, and it's something that has been happening in the private sector, but not so much in the government sector, which is one of the reasons why when we work with organizations in this sector, we talk about healthcare is now becoming much more of a business, and businesses know that in order to succeed, they need to actually offer exceptional customer experience. So we do a lot of work in customer experience, and this is one of the reasons why we do a lot of cross-fertilization into the healthcare sector on some of the best practices that companies, that Amazon, Noon, if you're obviously if you're in Saudi Arabia, you know of Noon and into GCC, or Net-a-Porter, the kinds of activities that they use are what actually gets patients or customers to come back to their organizations, to their businesses. So when we work, because all of this will require a lot of change internally. And when we work with our healthcare institutions, one of the things we're very, very, very focused on globally and locally is the first step to transformation, which is everything that we talked about in the Vision 2030. You need to be thinking about how I'm going to embed this transformation using the focusing on the 5 areas that I mentioned earlier in our model of end-to-end patient experience. And the first thing that needs to happen is your leadership needs to be completely engaged and committed to shifting the experience and that mindset, and really creating a culture that is much more ingrained and understands customers or patients in the same way that a customer would understand its It's a business would understand its customers. There has to be a patient-driven vision, and I'm going to come back to this when I talk about the Cbahi standards. One of the core Cbahi standards, and I will explain what Cbahi is for those who do not know. For the accreditation of Vision 2030, you need to have a clear expression of what is your vision for patients. And that vision also drives internal engagement. Remember, we're focusing on employee and patient experience. These two come together, and you cannot have happy patients if you don't have happy employees. So that patient-driven vision helps you embed that understanding that this is what we're offering, this is the value that we're bringing to our patients. We then have to focus on defining what patient experience is. And we talked about the difference between process, the old type, very functional, old type of Heinz tomato ketchup, versus the actual effortless and easy and positive experience like the new modern Heinz ketchup. So we have to really build that definition of patient experience internally. Then you need to manage the patient touch points. And here's where we look at, excuse me, not just the interaction, not just the safety of interaction, but also the quality of the interaction. And that is, again, where the feedback comes in from the patient. So here's where we have to understand, are we dealing in delivering the service to the patient that we want, or are we delivering it in the way that makes them feel good about where they may be today with us? And that's a mindset shift that is quite significant. I would suspect you agree with me. Then you need to look at measurable service standards. So these are, what are the skills and how are you measuring these skills levels, but also the interactions and the quality of interactions at each point. And that is where, again, this links back to Cbahi. One of the things that you think about is in the experience is how are you linking and how are you measuring what you're doing with outputs which relate back to the Cbahi standards. We also then have to measure PX performance, and here one of the key things, it's not just patient experience in the sense of, is it effortless? Are we actually delighting our patients and making them feel better? But it's also, are they driving financial performance? Are we also helping the organization save money or make more money, depending on whether you're private or government? And finally, this is all part of a continuous improvement plan. So when we talk about patient experience, it never ends. It's a conscious feedback loop. So we are at the point where we have to get the feedback, hopefully on an ongoing basis, not just at this point. We encourage that feedback, and then we act on it, and we innovate. And then we go back to the beginning where we started with leader-led commitment. This is a cycle, but even though it looks like it's an upward trajectory and there's an end point, no, it's a cycle. It's an ongoing cycle. And the reason why I speak to you about this is because in order to achieve all of this, one of the things that we've done is we've developed a lot of what we call the total experience platform tools. You need to have actually a multitude of tools, not just the understanding of how I deliver the service, but you need to be able to do a multitude of things. Number one is we actually ask and encourage our clients to really think about what's the attitude towards patient experience. And we have the experience typology framework, which is unique to us, that helps us understand where the different departments in relation to how they feel and understand patient experience. We need to be thinking about, are we benchmarking ourselves in our department against the best of breed, if you like? And we do a lot of benchmarking. Strategy and vision creation, that's a fundamental part of patient experience. What is that patient experience vision, and how are we going to execute that? That is part of the change process. That's part of the transformation. And again, it links back to the Cbahi standards. You need to be able to incorporate what we call OKR management, which is objective key results. We move the organization from this percentage in terms of KPI to another percentage. We are always data-driven, evidence-based, as we would call it in healthcare. But we have to be clear on what are the objectives, what are we trying to move, what dial are we shifting? We do a lot of work around mentoring and, as I mentioned earlier, capacity building, guiding patient experience ambassadors, internal stakeholders, leadership teams on understanding how to really embed this new mindset and more efficient approach to patient experience when we're thinking about, again, the emotional connections at each step. And finally, design thinking and journey mapping and understanding our patients. No two patients are the same. Healthcare is probably one of the most complex scenarios that you can imagine or envision or work in, as you know, where you have to understand that each patient, you might have two patients which have similar symptoms, but they may have completely different issues and diagnoses. So here we have to think about the journey that they're likely to take and map that out from end to end, from the moment that they are aware that there's something not right, through to consideration, through to making the decision that they will come to your institution, then the service delivery, then the follow-up. All of those are part of the journey that you also as an institution or individual would have to support your teams to go through. This is where one of the most important elements around the transformation lie. We have to find what are the different, what we call personas. Who are your typical patients? A patient who does outpatient, who use outpatient services, it is very different to those who are who are hospitalized. So this is what we have to really think about. Or chronic disease. Chronic disease is very different managed to something that may be acute. You know this, I know this, but it's about transferring this into a very clear set of maps that the journey that the patient goes through from the end-to-end perspective and understanding how they feel at each point and how we're making them feel better or more emotionally engaged. So going back to the Cbahi standards, Cbahi, and this is where I prepared a few bits of information. I always discuss these because it's important when we're thinking about patient experience. We have to abide by what are some of the accreditations. The Saudi Central Board for Accreditation for Healthcare Institutions is the official agency to grant accreditation certificates to all government and private healthcare facilities. So it is now imperative for every institution to go through Cbahi, and it's mandatory to comply with those standards. In fact, one of the things that CPTC, our partner company in Saudi, does is we actually do a lot of work with them on this, is actually do the surveys, mock surveys, and prepare organizations for the Cbahi accreditation. Now, you'll say to me, well, why is this relevant, Christina? What do I need to know? Well, here's the thing. When Cbahi come in, or whether you have the actual Cbahi accreditation, you have the ambulatory services, so the outpatient service standards, and you also have the in-hospital service standards. And they're very clear areas. In fact, here is literally a cut and paste of all the core standards, if you like, where Cbahi focuses on the experience in terms of how the leaders support and protect the patient and family rights. So this is LD 22 for those who want to take a note. And the standards are: the leaders develop and maintain a patient's rights and responsibilities statement. Remember the patient experience vision statement. This is your patient rights and responsibility statement, and develop processes that support their implementation. Remember the 7-part model that I took you through? Well, that is a clear example of the processes that you support, that you can undertake to support their implementation. The leaders ensure that patient rights and responsibilities are available to patients and families, and ensure patients are informed about their rights and responsibilities in a manner they can understand. So this is about, when I said to you, what are the mission, vision, and values which we define as part of the patient experience definition and mission statement, that sits in there as well, because you have to communicate those to your patients. And the way you do that is, obviously you have your You have your signage, but also you can have handouts on digital platforms. You don't need to be spending a lot of money. You just have to be focused on getting this to the patient in a way that they completely understand. Leaders ensure that patients' dignity, privacy, and confidentiality are respected. So this is making sure that in your processes, you're thinking about how am I making sure I'm sticking to the data protection laws and the choices when it comes to the medical records that patients want. Leaders ensure, number 4, that staff are provided training and education on patient and family rights and responsibilities. This sits squarely on needing to understand patient experience and the rights of the patient, but also managing the safety element with the delight element. And that's where the quality comes in. So those are the first of the ambulatory services. Then we have LD23, where leaders ensure that patients, families have right to be involved in their own care and treatment. So here we've got 5 areas where patients and families have the right to be informed of their illness, the proposed treatment, and its prognosis. So here we talk about how are we communicating to the patient what is their ailment, but also how they can be part of that process of what the protocol is and how they contribute to it. The second one is about the right to be involved in the decision making of these care plans. Do they fit into their day-to-day requirements, day-to-day living? It's a fundamental part of the experience. We also discuss this as part of a patient experience transformation workshop, which I'll talk about in a few moments. Patients and families have the right to professional assessment and management of pain. This is where you log in how you're actually improving the state of the patient when it comes to pain management. And when we talked about the definition of pain, do you remember I mentioned it's about the emotion and the fears and what they're feeling? This is exactly a great example of, if you take this into consideration, you need to have somewhere logged how you're actually making sure that the patient has an understanding and access to management of pain. Then patients and families have the right to refuse or discontinue treatment or ask for a second option. This is very important because it's about trust and about the freedom for the patient to be able to have these very open conversations to say, well, actually, this doesn't work for me. I would prefer if we could do something, instead of giving me pills, please, or instead of giving me an injection, please give me pills, for example. Very simple example, but that is about logging their desires and having the flexibility in the system to abide by those. That is normally, and I'm sorry to say, in the majority of healthcare institutions, a lot of the times it's our way or the highway. Right now, this is a step change. We have to think about how are we making it easy for the patient to actually to refuse, change, or adapt their treatment. And there they have the right for patients to request a detailed medical report or sick leave notification. It's fundamental for someone like me who's very international, lived and experienced the world globally. This should be second nature, but it's very important to keep reminding ourselves that actually any ailment impacts our day-to-day life, and how we, again, allowing for the request for the medical report and sick leave, which should be automatic. We don't have to expect the patient to ask for us for it in an ideal world. We should ask the patient in advance. Then we have LD24, which is leaders develop and implement a policy and procedure to describe patients' rights to voice their complaints and concerns. And I mentioned this when I talked to you about how are we getting the feedback, how are we actually picking up complaints, and what are our SLAs. Patients' complaints are resolved in a time frame described in the policy. So a service level agreement is your SLA, is how quickly will you resolve the issue? And the center, the healthcare center, also needs to assign a staff member responsible for managing complaints, both at the grassroots level, but also at the senior leadership level as well. Patient satisfaction surveys are conducted at least quarterly. We would encourage not only to do quarterly surveys, but also get ongoing feedback, where you see here, as it says, data collected from surveys and complaints are analyzed and trended, and the information collected is used for improvement and integrated into the quality and safety program. That's where you actually, if you actually get the feedback on an ongoing basis, then you can act on it much more quickly than just expect for it to be quarterly. In fact, the best organizations in the world, Cleveland Clinic, Mayo Clinic, don't do quarterly surveys. They actually have an ongoing feedback system that allows them to adapt and change very quickly in order to appease the patient and meet or delight them as part of their experience. In the final part of the outpatient service standards, leaders need to ensure that patients and families have the right to accurate billing for provided services. So here's where we need to be very transparent. Very often billing is seen as a secondary back office, not relevant, but actually it is a fundamental part of the experience. Leaders need to ensure the availability of a price list for services provided to patients and their sponsors. They have the right to receive the estimated cost, initial cost, and also they have the right to obtain an invoice. How we do that is a fundamental part of patient experience. Why? Because if I'm being asked to go in and I need to actually pay, I need to know how much it's going to cost me, but at the same time, I also want to make sure that I'm being brutally transparent as well for my sponsor, which in this case could be an insurance company. So this is where a lot of institutions actually don't consider the relevance when it comes to the experience piece around finance and billing. So we've also got the inpatient service standards, which I'll just skim through. But the LD31 is the standard where the department head ensures performance measurement and improvement of the outcomes of the department. And it's all about performance measurement, which are consistent and hospital-wide, for quality improvement, patient safety, and risk management. So all these performance measurements when you remember the 7-part model that I talked to you about, when we actually log what we're aiming to do, so this is a vision, and then we're actually measuring, then you automatically have the inpatient performance management, you're meeting with the Cbahi standards. But it's important to make sure that you're logging, it's ongoing, it's clear, and the department and their supporting committees have the ability to promote, but also change the improvement efforts. So there's a whole range of standards which we don't have time to go into now, but we go into a lot of this detail when we do our patient experience transformation playbook, session, which I'll talk about in a few moments. And when I talk about what are the important things to do in order to balance safety and quality, well, if we're going to undertake the transformation of patient experience, we need to think about the experience adoption curve, and that's from awareness, understanding, acceptance, belief, application, and transformation. So we need to take our organizations not only from being aware about PX, but through to understanding how it's relevant to them, accepting that it's part of their day job, believing that they are part of the process, applying it day to day, and that's how we get to transformation. It's not an easy journey, but it's a journey that's filled with opportunity to drive that emotional interaction and that engagement from our patients. And we've got the ability to do that here when we are talking about patient experience, and when we do our patient experience transformation playbook training. Now, one of the ways that we actually help organizations do this, and we encourage you to do this, and it's a couple more minutes that I've got left on this, is think about the patient experience cultural transformation blueprint. And that is your patient-centric vision and DNA, which we talked about earlier, and creating internal ambassadors. Those ambassadors help roll out new values and behaviors. They help instill patient-centric systems and processes and the KPIs. These are a fundamental piece of the transformation blueprint, which is part of what we talk about as well to help you build the Vision 2030, your Vision 2030 operation. Now, one of the areas I mentioned that we're going to talk about is do's and don'ts. And this is kind of the final slide summarizing everything that's important for us to think about when we are taking forward organization when it comes to Vision 2030 and the healthcare sector transformation. Do take a holistic end-to-end view like we do of patient experience. I mentioned this 5-part model. Do incorporate all areas of the preclinical, the clinical, and the post-clinical phases. Do not avoid what you think to not be part of the clinical service delivery, because your patients don't think that way. Your patients think of you as an organization that's going to help them from end to end. You need to think about, and I talked about pandemic migration, the relevant systems and solutions that drive patient-centeredness and future scope processes. One of the areas that I mentioned is the digital transformation that is part of Vision 2030. And your activities must abide by the Cbahi standards. It is not a nice to have. So this is where I would say to you is focus on those do's and don'ts, and then join us on the next, the Ultimate Patient Experience Transformation Playbook workshop that we're running, abiding to Cbahi standards, really focusing on driving that transformation internally. And so we've got one coming up actually around the corner. And so the dates are the 28th, 29th, and 30th of November in Riyadh. There'll be many dates. So if you're watching this after that particular session, there's many dates. Check on our website, and hopefully we'll see you there. And I'm open to any questions. If there are any questions, I know we're short of time. So if you want to drop me an email, my email is actually at the beginning of the presentation, which I will go to right now. So please stay in touch. And yeah, all the best for creating a patient-centered organization for Vision 2030. It's been my pleasure to be with you today.